Good morning, everyone. My name is Tista Kassergod, and I'm your host for these Fireside Chats with Leaders and Innovators. This is a series of conversations with leaders in our community who have many significant accomplishments and are creating positive impacts in our world. Today, I am so excited to share with you a conversation with a very special guest, President Paula Johnson. President Johnson has served as the 14th president of my college, Wellesley College, since 2016. She is a physician researcher specializing in cardiology who founded and served as the inaugural executive director of the Connors Centers for Women's Health and Gender Biology at Brigham and Women's Hospital from 2002 until 2016. Dr. Johnson also served as the chief of the Division of Women's Health at Brigham and Women's Hospital during this time. She was also the Grayce A. Family Professor of Medicine and Women's Health at the Harvard Medical School and Professor of Epidemiology at the Harvard School of Public Health. She is a member of the National Academy of Medicine and the American Academy of Arts and Sciences. She has been recognized with several honorary doctorates and other prestigious awards. She serves as a member of the Board of Directors for Johnson & Johnson and served on the Board of Trustees of Rockefeller University since 2021 and as a director of the Isabella Stewart Gardner Museum since 2015. President Johnson, thank you so much for joining me today for my first in-person fireside chat since the pandemic.
It's great to be here with you, Tista.
Thank you so much. It is truly such an honor to have you and to share with our listeners about your many amazing accomplishments. So I would love to begin by talking a little bit about a large part of your career as a physician researcher. So I have this little quote from my human rights class that I took here at Wellesley by sociologist Catherine Strother Ratcliffe, who wrote about health and human rights, and she discusses how healthcare should be equitable, not equal, because it is not a one-size-fits-all standard, since sex and race are biological variables. I have read about the same understanding that you have expressed when it comes to a lot of the work you have done, like, for example, encouraging the inclusion of women and minorities in clinical trials, like, for example, with President Clinton's NIH Revitalization Act. So what made you arrive at this outlook of inclusion?
So it's a great question, and I'm not going to go all the way back to where I started. But early in my college career, I took a course, and by a very influential person in my life. She was the first person to be tenured in the Department of Biology at Harvard, Ruth Hubbard. And it was biology and women's issues. And it was really opened my eyes to a lot of the issues of sexism in science, and how we actually don't include women in many trials, but also how the healthcare delivery practice needed to change. That was very, very early on in kind of the thinking about this. So, I took the course, did an independent study with her, but I think it was really after my college years and really through medical school that I began to explore these issues more deeply. I was very interested in public health, so really thinking about the, kind of healthcare delivery, the translation of the science for populations, not just individuals. And through my time as a faculty member, really then worked with the administration to develop a broad-based program, the Connors Center, and an academic division that really delved into the topic of sex, which is biologic, gender, which is a more social phenomenon, the intersection of the two, and then how race and other social determinants of health impact one's biology, and then how do we get the outcomes that we should be stratifying by these determinants, and then how does that impact, or should it impact, healthcare? So, the Connors Center really looked at that broad breadth of basic science, all the way to clinical research, all the way to practice, and then impact on populations. I do want to correct one thing in the statement you read, in the quote you read. Race is not biologic, so it's really important to understand. A lot of people think that it is, but it is not. So, sex is a biologic. We are genetically either. Now there are some variations, but it is a biologic determinant. Obviously, gender is something different, and race, for a large part, is socially determined. It's a social construct that can have impacts on your biology, but it is not biologic per se.
Thank you for educating me on that.
It's important.
It is important, and I appreciate that you've, taught me. I'm constantly learning from you. I consider you to be a very thoughtful individual, and I truly believe in you and how much work you've done for so many communities around the world. And so obviously, from your start in the class to now, I know how special a professor and a class can be, and how it can give you a worldly outlook on things you've never considered before. And so that is also why I would love to talk to you more about, Wellesley College and being president of this amazing institution. So my first question about Wellesley is, at the Women in Science and Healthcare Symposium, you were the keynote speaker on how sex, gender, and race impacts science and medicine. You said something which really struck me as very wise and applicable in all situations, even outside of science and medicine. You said, "Who you are influences what you see." And although this was said so casually in the moment, I really think it's so important to have a president like you of such an amazing college who's able to recognize this when it comes to all students. So how do you maintain the sensitivity regarding supporting all students, especially when it comes to delicate topics?
No, I think it's a great question. First, let me just say it's really been a tremendous honor being the president of Wellesley College. It's a phenomenal school with outstanding students, outstanding faculty, and a staff that is here to really be a part of the team delivering the best education that we can to our students. And I think what our students go on to do in terms of impact in the world, I think are really, it's evidence of that value. It's been an interesting journey in that, as a physician, you have to listen deeply and think about how you are interacting with individuals or groups, what perspective they're coming from, and how do you reach them? How do the two of you come to understanding? And I think that's no different in any leadership role. So as I think about my role, we've been able to bring together an enormous diversity of students from across the country, across the world, from cities, from rural areas, different racial and ethnic backgrounds, different socioeconomic backgrounds. So everyone comes with their own story, and that's pretty powerful. And modeling how we listen to those stories, listen to their triumphs, but also listen to what is potentially troubling or the challenges, is what we are here to do. It's part of the education. So what we're really hoping to do, what I hope to do, is as I, for example, listen to students or groups of students, you hear their concerns, and then it's really about the problem solving as to how we approach complex topics. And that is the preparation really for life, right? Because we want you to gain the skills through your education to be able to go out into the world and really not only face life's challenges, but also really help be the problem solvers, no matter what field you go into, what discipline for the future. So with that, I'm just going to say, Tista, I've so enjoyed meeting you. And, from when you transferred to Wellesley, you came and met with me, and I was just so impressed.
Thank you.
And I'd love to hear a little bit about how your experience at Wellesley is, how it's different from SMU, And what has your overall experience been?
So the first thing I would love to say is thank you so much. That is so kind of you. It has really been such an honor to come to Wellesley and to meet you and to learn from you. You lead by example, and so to learn from you is really an amazing thing. So the first difference I will say is having a president like you who engages with students so deeply. At every event you attend, you speak to everyone you meet, and you truly care about each individual for who they are. And so I think that really is a very special thing that we have here, a leader like you who has truly engaged with every single student you come across. And so besides that, I have absolutely loved Wellesley. I had a great experience at Southern Methodist University where I transferred from. I really found my place in the world there, where I found that I could take social issues that I cared about and apply them in an academic setting. But at Wellesley, I found professors who are professors of practice and who are showing not only through their research or their academic pursuits, but also through their everyday activities, such as their civic engagement and their work in their communities, how wonderful and how involved you can be in a community globally.
Mm-hmm. Fantastic.
Thank you. Thank you so much for asking me that question. I just absolutely love Wellesley. I think that the administration here and the students that I have met, as you said, come from such different walks of life, but they all are, emboldened by their common humanity. And I think that's a really beautiful thing to see, especially at a college like Wellesley, which has such an amazing history and with such amazing alumni. So the students who I've met, I can see them being the most amazing leaders one day as well. So,
fantastic. Well,
thank you. Thank you for asking me that. And so I actually would love to share with you a quote I read about you because, as I said, I really admire you as a leader. So this is from 2022. Senator Elizabeth Warren said that she has come to know you as a, quote, visionary leader with unwavering tenacity and a deep commitment to those who you work with and serve. And so I am a ministrare peer leader in the Office of Civic Engagement with the amazing Heidi Johnson, Mercedes, and Marcia. And so I absolutely care about civic engagement on campus, and I know you do as well. So I was wondering, what vision do you have for civic engagement at Wellesley, and how do you implement servant leadership in your own life?
I think it's a great question. I'm just going to begin with saying thank you for taking on being a Administrare Fellow. It's a very important leadership role that in which you really model a kind of servant leadership that I would hope would not only carry on in your life, which I know it will, but is a model for our other students, for our students. So, part of the purpose of higher education is to really educate young people who will be civically engaged in their communities or in their work, whatever it is, at whatever level. It is really what strengthens our society. It is what strengthens and is essential to democracy. So really thinking deeply about how we do that is very important. And in a way, discussion of the civic purpose of higher education has gotten a little lost. And it's been confused with public service, which you can be civically engaged by doing public service, but it's really the way you lead your day-to-day life and how you've engaged. So, at Wellesley, as you know, we've started the Hillary Rodham Clinton Center for Citizenship, Leadership, and Democracy. We really hope to touch every sophomore as they pass through Wellesley. We very purposefully made this program so that you don't have to apply, because we feel so strongly that it should be an essential part of the education. So I think that is one way, and you've engaged in the pilot of that program, and now you're engaged in a leadership role with Heidi Johnson, who is quite amazing, and Mercedes. It's just an amazing team who are leading civic engagement here and leading a lot of the development of the programming for the Clinton Center. And beyond that, I think the question becomes, how do we assess our success? And we're really at the nascent phase of working to understand what are the best ways we can measure our impact. So we know from just looking at our alumni that our alumni are off doing amazing things that have really made a difference in society. How do we know that we're educating for that? Is it by chance? Is it something in the water? So I think we want to be a little bit more, or a lot more, intentional about this. And we feel it's so critical for today, when there's a lack of trust in an increasing lack of trust in higher education, where there's increasingly just a pure focus on career. And don't get me wrong, career, excuse me, is critically important. But there's a greater sense of who you are as a person. So that's the journey that we're on. I would say for myself, I've been involved in a number of organizations and engaged in, mentoring from my early years in college, working with students who are coming along behind me. It's a kind of civic engagement. But then in career, really being very much engaged in organizations that are making a difference in the lives, whether it be of women or others. I chaired the Boston Public Health Commission, which is our public health department in Boston, for about 8 years. It was a volunteer job appointed by the mayor, but a volunteer job that took a very significant amount of time. But the importance of bringing together the threads of my work to be able to give back in a way to the city was very, very important to me. And then there's been work that I've done, whether it be through my professional associations. So for example, when I first came to Wellesley, I co-chaired a study with the National Academies of Science, Engineering, and Medicine on the sexual harassment of women in academic STEM. Why was that being civically engaged? It was because it's a major problem. It has never been looked at rigorously from really finding out what the evidence is, what is the rate, how has it changed over time, and if it hasn't really changed over time, which in fact it hasn't, why? And how do we prevent it? Because what we understand, excuse me, from the research is that women have dropped out and continue to drop out. Women of color are disproportionately impacted. So it is so important to do this work that is unpaid, but comes from a sense of duty to the profession, to those people in the profession, and really wanting to make sure that your generation, as you come up, does not have that experience.
Thank you so much for sharing. I completely agree. I think that you are a testament to committing yourself to being civically engaged while you are also, doing so much and accomplishing so much. And so I think reminding students that they too can have meaningful impacts in the world outside of just, paid work is really important. And so it really makes a lot of sense that we have you as our president, because you, as I said, lead by example. And I have to agree with Senator Warren's words about
Well, thank you. She was very, very generous, very generous. But let me ask you, I mean, you were part of that initial pilot cohort for the Clinton Center. You're now a Sed Ministrare Fellow. What has your experience been?
So I actually was not a part of the pilot
Okay.
program.
Excuse me.
But
You were so engaged that I assumed you were.
I absolutely love the Ministrare, and most of the Ministrare this year were from that program. So it is completely understandable that, that might have been communicated to you. I actually have a funny story about the pilot program. So I had just transferred to Wellesley, and the orientation was happening upstairs for the first years in our alumni ballroom, our beautiful Diana Chapman Walsh alumni ballroom. And I went downstairs to use the bathroom. And when I came out after, I was just ready to go back upstairs, and I saw you. Mm-hmm. I didn't know who you were at the time. I thought, what an elegant person who is addressing all of these students. I wonder what this is. I wonder who these people are. And I saw Heidi Johnson as well. And I mean, of course, I didn't know who either of you were. I didn't know what these students were here for. But I saw all of them. Even though there were, I think, about 30 in the room, all of them were just so engaged with what you were saying that I thought, I want to look up what this is. So I read one of the students' badges, and it said Civic Action Lab. So after orientation and all of that was over, I looked it up, I looked you up, I realized you were the president of the college, and there I was trying to get through the crowd after, hands dripping from washing my hands in the bathroom. And so I was just on my way upstairs, and I was thinking about, I would love to be involved with a program like this. And so that is where I looked up Ministrare, that is where I found the civic engagement website, and then I applied for the position. And so it's a very full circle moment for me, because my first day at Wellesley, really on campus, I had seen you and Heidi Johnson.
You were introduced informally. So what has it been like for you being a Sed Ministrare Fellow?
It has been a life-changing experience, because I didn't know how deeply you could involve yourself in the activities that the school has planned for community members. For example, we are currently, working on the Clinton Center, and one of the things that I have been doing is helping out during we have labs throughout the year, as you are aware. And so I think that having a experience where different students can come together, can foster dialogue, and can speak to each other despite all of their differences to find common ground, that is one of the most incredible things that the Ministrare position has shown me. I've literally seen it in action unfold in front of me, and it is because of the work that you, Secretary Clinton, Heidi Johnson, and then of course the two amazing professors who are faculty directors have done, is put together a program where I, as a student leader, can also engage with students and can learn from everyone just as much as they are learning from me at the same time.
Wonderful.
Thank you. So I actually, speaking of student engagement on campus, I am very involved with the Peace and Justice Studies program. I truly believe it is one of the most unique programs offered at Wellesley. It has two amazing professors who you know, and although I may be biased as I am majoring it and the department student assistant, I really believe that this program is a strength for the college. So through interdisciplinary collaboration that you mentioned earlier, and the development of critical and ethical thinking about diverse global issues, how do you envision evolving the program through your role as president?
I would, as I look at the curriculum, I don't necessarily think about any one discipline in and of itself. And I really think about how we're working with our faculty, and of course under the leadership of the provost, around some of our overarching goals. So for example, right now, Provost Courtney Coyle has a group of faculty who are meeting to really develop a strategy for how our faculty are going to be engaged in this work of constructive dialogue, enhancing dialogue across difference, really enhancing the ability of our students to address challenging, complex issues in the classroom. And it's a continuum, right? In the classroom, outside of the classroom. How do we bring different perspectives to Wellesley, both inside the classroom and outside of the classroom, but really equip our students with the skills and the environment? So that's a pretty big undertaking. Mm-hmm. And so I do think that the faculty are so critical in the work that we do and the work that, they're central to the education, obviously, but as we think about this idea of dialogue across difference, how we really embrace complex issues, they are at the core. So I think that that's true, really, for all of our faculty.
I honestly really do commend the faculty because, as we've spoken about before, during my transferring is not the easiest process, because coming in as a junior to a new school where everyone has formed their social settings and the school is brand new to you but not to everyone else, it is a really interesting experience. But the faculty have really provided me a support system, all of them, through all of the classes I've taken. They have really been there for me both in and out of the classroom. And so, speaking of outside of the classroom, you've also been very involved with on-campus initiatives. So one of these initiatives is free emergency contraceptive vending machines, and you, in your own work, have supported the inaction of accessible low-cost contraceptives as a preventative service for women. So how do you view this important step of these vending machines for student health and well-being?
Well, I just have to say, I had very little to do with it. And it was really the initiative of our students, which I think is something that I'm very proud of. Our students came to us and they wanted the vending machine. They had done a lot of the research. So our job as the leadership was really to just figure out some of the specifics. Where was it going to be? How was it going to run? That type of thing. And we did that with the students. So, I think to me, it's a wonderful example of students taking the initiative and really thinking about their classmates and what's important. So it was a very proud moment for me when our students came to us and said, we really want to do this. Having important reproductive care is so important to women, and particularly as a women's college. So I think this type of access has been important. And, a number of years ago when the Affordable Care Act under President Obama was being implemented, we were asked, it was part of the legislation, to have a study from the National Academy of Medicine, at that point was called the Institute of Medicine, to come up with the preventative services for women. And we came together, worked quickly, and we named 8 preventative services that we felt were evidence-based and really needed to be covered without cost sharing under the Affordable Care Act. And one of those 8 was in fact contraception, and the full range of contraception. So it was a very proud moment. For the most part, it still holds. And I think it's an important, it's important for women to have that kind of access.